Good afternoon, friends. My name is Dr. Deodatta Chafekar. I am a practicing physician, intensivist, and nephrologist, and I am practicing in the city of Nashik since the last 25 years. Today, we are going to discuss briefly about urinary tract infections. So, before we go to the topic, let us discuss about what are the global trends as far as urinary tract infections are concerned. Globally, the number of cases of urinary tract infections increased by 60%, and it increased from 252 million in 1990 to 404 million in 2019. Now, in 2019, there were 230,000 global fatalities attributed to urinary tract infections, and this was a significant rise of almost 140% compared to 98,500 deaths recorded in 1990. In India, when it comes to community-acquired urinary tract infections, the prevalence rate stands at 10%, with a particularly high rate of 86% among the adult population. In uncomplicated urinary tract infections, the majority of instances originate in the community and are primarily caused by uropathogenic strains of E. coli and Klebsiella species, and this constitutes approximately 75 to 95% of all cases. According to the American Medical Directors Association Infection Advisory Subcommittee, treating urinary tract infections involves several key considerations, such as initiating the antibiotic treatment at the right time, selecting the appropriate antibiotic, adjusting the treatment plan based on clinical response and culture results when needed, and sustaining the antibiotic therapy for the correct duration. Now, according to the AMDA's Infection Advisory Subcommittee, empiric therapy with broad-spectrum agents should only commence when clinical criteria for UTI are confirmed. For patients with severe symptoms and signs of systemic infection, the initial approach involves starting empiric treatment and then adjusting based on the results of urine examination and the clinical progress of the patient. In cases of mild symptoms that meet the clinical criteria for a UTI, the choice of empiric antibiotics should be influenced by a local resistance pattern. Now, urinary tract infections are primarily caused by gram-negative bacteria. However, in the last 2 decades, gram-negative bacteria have developed complex resistance mechanisms against multiple antibiotics. Beta-lactams are frequently used for urinary tract infections due to resistance to other antibiotics, such as sulfamethoxazole trimethoprim combination, and there are some potential side effects also related to fluoroquinolones. Now, narrow-spectrum beta-lactams may not be ideal for empiric coverage. Broad-spectrum cephalosporins, such as cefpodoxime and cefuroxime acetyl, are FDA approved for uncomplicated urinary tract infection treatment. Now, among adults, frequently prescribed antibiotics include cefuroxime, norfloxacin, and amoxicillin clavulanic acid, along with others like plain amoxicillin as well as nitrofurantoin. Now, while third-generation cephalosporins are appealing choices for empiric therapy in UTIs due to their broad pathogen coverage, it's important to note that they have been linked to higher rates of Clostridium difficile infections and the emergence of ESBL, which is extended spectrum beta-lactamase expressing pathogens. Second-generation cephalosporins, such as cefuroxime, offer effective coverage against enteric gram-negative bacilli, Haemophilus influenzae, as well as Neisseria organisms. Additionally, most second-generation cephalosporins provide moderate coverage against Streptococcus and Staphylococcus organisms. Oral cefuroxime attains a higher urinary peak concentration ranging from 1000 to 7000 milligrams per liter. 50% or more of an oral dose of cefuroxime is excreted unchanged in the urine, and it has almost 98% cure rate. Additionally, cefuroxime has a minimal risk of adverse effects. Managing urinary tract infections, therefore, requires prompt antibiotic administration, a careful choice of antibiotics, and you need to modify the treatment based on patient response as well as the culture results. And of course, you have to adhere to the recommended duration of treatment. Now, in case of severe symptoms or a localized antibiotic resistance, it may be necessary to use these antibiotics empirically, and these should be of broad spectrum. Cefuroxime, a second generation cephalosporin, is advantageous due to its extensive coverage and elevated urinary concentration, and stands as an effective and safe choice for empiric therapy in patients with UTI. Thank you very much for your attention, and I hope that this particular video has told you about how to manage urinary tract infections which are community acquired and how to use broad spectrum antibiotics, especially cefuroxime acetate. Thank you.